Over the past 2 decades, Ethiopia has made impressive strides in reducing poverty by making the right investments to increase access to basic services. It's one of the world's fastest-growing economies. Yet there is a paradox. An average of 5 million people a year still need humanitarian assistance. How can this constant cycle of aid be broken? How can communities become more resilient to withstand recurrent shocks like droughts? This is the challenge that the new way of working seeks to address.
It's a paradigm shift from managing crisis to managing risk, from being reactive to being proactive, from one sector show to a multi-sector show.
This isn't just theory. We've actually seen it work. And the new way of working is about really building capacities, national capacities and systems to prevent crises from becoming disasters and catastrophes. So that is at the core of the UN's reform agenda.
The new way of working is about meeting people's immediate humanitarian needs while at the same time reducing risk and vulnerability in the long term. It's about taking preemptive action by investing in risk analysis and reinforcing leadership at all levels. This means early action can be taken to mitigate the frequency and impact of hazards and disasters. The traditional divide between humanitarian responses and development interventions must be bridged by strengthening response systems and integrating the two so they're mutually reinforcing. We know it works. Let's show you how. This is a mother-to-mother support group and outpatient treatment program in the Mille area near the Awash River in the Afar region. It caters for children up to the age of 5. The scheme in Mille was started in 2015. Now there are plans for it to start providing life-saving child vaccines. This is an example of how to take preemptive action and make investments to achieve better child health and hence build resilience. So what started as a response to food insecurity has developed into a strengthening of health systems to ensure people, especially children, don't fall ill from preventable diseases.
When there is drought, there is malnutrition. So we have a nutrition agenda. When there is drought, our people, our children, because of lack of food, there will be school dropouts. So it's an education issue. When there is drought, the girls, the women, they will be in a very bad situation. So we need protection.
I think this whole idea that we can link what we do in the humanitarian field with what happens in the development and not have these two parallel structures and processes is one that is at the heart of the initiative in Ethiopia and also that is in line with what the Secretary General is trying to do. But more importantly is the need to integrate different elements of what we do so that we're not working in silos. We're able to bring the different sectors together and build on the synergies because one activity is linked to the other. And part of the problem has been the fragmentation in the way we work. So the new way of working, it's indeed about this integration of different elements so that we have a holistic approach.
Good hygiene and nutrition, of course, depend on access to clean water. This water scheme was begun in 2014 in a remote part of Ethiopia in Haroa Kebele, in Dewa Haroa Wareda, and it serves several villages. It's part of the One Wash program, that's water and sanitation hygiene, implemented by the Ethiopian government and its partners. Prior to the implementation of WASH, people either fetched water from the nearby river, with the responsibility falling largely on the shoulders of women, or the authorities would send water in by truck, which was both costly and time-consuming. The distance between the river and this community is around 1.5 kilometers. So the wells, and particularly boreholes, have radically changed people's lives for the better. Also, the incidence of diseases like bilharzia, contracted from dirty water, has gone down dramatically. Halima is a 20-year-old local woman.
ወንዝ አለመሄድና ጥራት ያለው ውሃ በማግኘት ሆድ ህመም የለም። ጥራት በቃ ውሃ ላይ ችግር ነበረ። የሆነ ነገርም ብንሰራ በወገባችን ሳንቀዳ አይገኝም። ያው ቤት በመገኘታችን በጣም ደስ አለ። ትምህርት ቤት ይረፍዳል። ጓደኛ ጋር መሄድም የለም። ትምህርት ቤት ስንሄድ በቃ ጽዳት፣ ልብሳችንም ማጽዳት። ስለ ንጽህና ደግሞ ሽንት ቤት ስንገባ ውሃ ሽንት ቤት ጠገባ አድርገን በውሃ ከዛ ስንወጣ እንድንታጠብ ውሃ አፍልተን አቀዝቅዘን ነው የምንጠጣው። አሁን እንደፈለግን መጠቀም ነው።
The water is pumped by a diesel engine and the community pays for what it uses. It costs around 50 cents for 30 litres of water, and the local water association collects the money, which then goes towards maintaining the well.
The new way of working is definitely something that will help us cut cost. And I'll give you one example. This past year when we had the drought, and also last year, indeed, when we had the El Nino, we had to do a lot of water trucking to populations who were facing water stress. And in some cases, it was much more expensive to truck water to communities than if we had had sustainable water development for those communities in the first place, such as digging deep boreholes. We have examples that where this has happened, these communities have not had to depend on water trucking.
But this project isn't just about clean drinking water, it's also about agriculture. As in many countries, the management of water systems, for instance in irrigation, must be geared towards conserving precious water supplies. By adapting the way we acquire and use our water, we can help mitigate the impact of climate change.
Even if weather variability or change occurs, we have to establish a climate resilient system. That is what we are embarking now as a new approach in terms of managing this problem and also reducing the risk associated to climate and climate change. It means we have to explore where reliable water resources are available. It could be deep groundwater, not easily affected by varying rainfall amount. In the past, we used to do just water supply schemes from shallow wells, from rainwater harvesting and so on. That is basically not resilient because when the rainfall disappears, that water source will not be also available. So the new concept we want to do is identify the most resilient, most reliable water source and then distribute it through water infrastructure.
Mapping is very, very crucial. The use of satellites to pinpoint sources of deep groundwater is vital.
We have to use modern tools like remote sensing, geographic information system to map many aspects. The physical physiography itself needs to be mapped. Where people are settled, their pattern of movement from place to place, particularly in the pastoralist area, need to be also mapped. The demand centers need to be analyzed. These days, this could be easily analyzed using geographic information system. That is one type of map. The other type of map is to see through technologies where we have high potential groundwater, for example. Remote sensing technology could help us to really penetrate into the depths and see where the reliable groundwater sources are available. The third is also to look at the socioeconomic condition, the climate behaviors by taking the rainfall, its pattern, its variability, how it is changing from time to time and map it across the region and see where
most vulnerable population live, and therefore match that resource availability with vulnerability, and accordingly plan, design, and construct the infrastructure that is needed.
The management of water resources is of utmost significance in a country like Ethiopia, where droughts are common. These used to happen roughly every 7 years, but now because of global warming and desertification, partly from the overuse of natural resources, a lack of water is virtually an annual occurrence. We know these potential disasters can happen. They are predictable. So, with preemptive action, their harmful impact on people can be reduced. This is a community of IDPs, internally displaced persons, at the Gabi IDP Center in City in the Somali region of Ethiopia. Most of the people in this part of the country are pastoralists. Their animals need good grazing land, but they were hit hard by the drought. The government of Ethiopia, together with its partners, have provided water supplies and have helped these pastoralists turn their hand to farming. So now they are agro-pastoralists. Instead of being aid recipients, they are now surplus food producers with healthy livestock.
هذا كهر هذا كشيء حالات يجي هردي أنا وحنا نحول الدقاتو يان هين وحبر ما قولين وحبيو نوضع تنا مارك جرين دحها لقوا روري جري أبار دكان كل كدقان كي كدعضو وانجوري جرني سومالي انجوري جرني صدق بقولو كيلومتر بانجوري جرني دي إنتان إسكيت تجنو حافظها يوح عين كان حولك عايزين جرني ماشى تقعد لان نو آسين جرني هذا كل واحد من إنه واحد تذكي يا بارتي نو إدارتي وواحد بدنا يخلي يسي وحي تانك حين ماشى تقعد لو آسين كل ما تقعد واي جرني وان هالكي أنت تجني سومالي أبا أنت قاعد أنا جرني يهرب كده ما كواي جرني بيت وحش كل دوما هندي أنا نرش عن مركز كجري حتى تانك كسواناي وحش كل دوما طرفات سن أو لدنت أو حتى لا 1 كيلومتر لا أرورو إن 3 كيلومتر للجورو رفاضاً كجري يدي إمك بيوان هلي إن برتي وان سقطها هي اللي ديوانه إن كسر سارة إن كعنا وان حس كل دوبة دما.
Drought will never stop in this country. Drought, as it is a climate change induced factor, it will continue to happen. But for sure, we can reduce the impact of drought. This is what we have done in the year 2015 and 16, where we have the most devastating drought happening in this country compared to the previous 30, 40 years drought, but we managed it with at least no mortality, while we had hundreds and thousands of people dying before 40, 45 years. When there is drought, there is no clean water. If there is no clean water, there will be acute water diarrhea, which is epidemics. It's going to be a health issue. When it's drought, there is death of livestock. So the very nature of drought, we treat it in a multi-sectoral way. It's not by delivering food or dispatching food that we managed the drought. Rather, we intervened with a partnership, with a cluster type of arrangement, having our water colleagues to deliver water, having our health colleagues to give the vaccination, having our education colleagues to have a school feeding program.
The figures speak for themselves. In 2003, 14 million people in Ethiopia were affected by drought. In 2016, it was 10 million, and in 2017, it was 5.6 million. The payback from this kind of collaboration between the government, UN agencies, and NGOs is that Ethiopia is turning humanitarian interventions into long-term development models, transforming the lives of people living in areas prone to drought, so-called hotspots.
intaan halkan taad dhex joogo iska difaaci karan de tagaadan baan rid biyaha baan galino tagaadan baa i bixiyo ridin baan siisan oo siciin baan siisan.
With 25% of the country's budget allocated to reducing poverty, it's no surprise that in rural areas dependent on agriculture, poverty rates have fallen substantially. Another invaluable tool in lifting people out of hardship is the Productive Safety Net Programme, or PSNP, which is part of a strategy to help people living in areas prone to drought. It's another example of a concrete and immediate measure that has long-term benefits for development.
In 2016, we have developed a policy, social protection policy, and the productive safety net is an instrument that be used in implementing these policies. Basically, we have already identified about 7 to 8 million people who have been affected by recurrent drought, not necessarily throughout the years, but also the food gaps, maybe 2-3 months every year. And this program is covering or addressing these short-term challenges that people have so that their assets are protected, but also their livelihood is not affected. And it's biggest program in Africa. The government has assigned huge resource, but also topped up by the partners in terms of supporting this social protection. Ultimately, our goal is for self-sustained economic growth and society. But it doesn't mean that even Ethiopia moves to the middle-income country, it doesn't mean that it's not working with NGOs or with partners. But the form of participation, the form of partnership might change. It may not be necessarily in the ODA form, but it could be in the investment, in trade, in other forms. NGOs are always contributing in our country in the social development, and they will have always roles, but not in the form of addressing humanitarian issue, may not be. So we will be working a lot with them in building the resilience of Ethiopia economy, but also Ethiopian society.
The UN is fully, 100% committed to this way of working and to supporting the government's vision on this. And the reason is quite simple. This is sensible, it is humane, it is about being cost-effective and efficient. It's about empowering communities to take responsibility for their own development, rather than reducing them to communities that just get handouts every year. There is no dignity in that. So it's about ensuring that dignity of communities and of a country, indeed. And it is also about the equity agenda. We're talking about the Sustainable Development Goals today. At the heart of that is that we should leave no one behind. As we pursue very ambitious development goals, there will be those who need to be supported to catch up. And this new way of working is making sure that those populations have access to what they need to bring them to that level without condemning them to a charity case.
The new way of working does not see humanitarian and development initiatives as mutually exclusive with no common goals. It seeks to reduce humanitarian need through early investment in development and building strong local capacity, policies and systems. It does not wait until humanitarian needs are addressed before investing in development. An integrated approach means both long-term development is tackled along with vulnerability to shocks, especially in drought-affected areas. The new way of working is about strong integration and coordination between all government actors, development partners, the private sector, and research institutions. And it calls for innovative interventions as well as innovative sources of development financing, for example, through public-private partnerships. Climatic shocks are set to be more frequent and severe in the coming years. This means there can be more humanitarian disasters which put development gains at risk. The good news is that there is a new understanding among partners that the humanitarian and development sectors should work more closely together. The new way of working can make communities better prepared and more resilient.